talk about prevention. What do we do?
Okay, so number one, public enemy number one, cigarette smoking, okay? I notice that message has gotten around pretty well in the U.S., not so well here in Europe, and not so well in Israel. I see a lot of people, and I was just recently over the vacation, a week in Paris with my family, and I saw lots of people walking on the street with cigarettes. It is a guaranteed way to accelerate this atherosclerotic process. By the way, there's a long list of other horrible diseases. Lung disease, which by the way is a terrible way to die because it's like drowning all the time. You're short of breath all the time. Terrible cancers and so forth. I've had friends dying from lung cancer who were smokers and so forth. So cigarettes are the absolute worst thing you can do. So that's number one. Number two is high blood cholesterol. And you may have a family tendency in that direction, or it may be the result of you're eating a very unhealthy diet, a diet very high in simple carbohydrates like sugars or flour, a diet that doesn't have much fruits or vegetables, a diet that's full of very high fatty substances. Often that makes you fat, number one, pushes you in the direction of diabetes, and also pushes your blood cholesterol up. One of the nice things about being here in Israel, people eat a very healthy diet. Of course, you have a fabulous agricultural system here. So the stores are full of fresh fruits and vegetables. Almost all of the big population studies that have looked at what correlates, what kind of diet is the best diet for people, and this is also for preventing some kinds of cancer like colon cancer, it turns out a diet high in fruits and vegetables, a diet low in refined sugars, so lots of sweets, and a diet low in red meats tends to be what comes out. And by the way, nuts and also fall into a good category. So all kinds of nuts. And if you're going to eat breads and so forth, the more fiber is in them, the more whole wheat they are, turns out to be better.
Okay, interesting. And now people talk about things like the Mediterranean diet.
Sure.
Has that actually been established and proven to help with cardiovascular disease? And what does that mean?
Sure, and the answer to your question is yes. So there were studies both in southern France, in Lyon, France, and there was a study in Barcelona where actually the data that came out of these population studies, which is not as it's suggestive, but it's not absolute proof, where some people were put on the Mediterranean diet and some people were eating, half an inch of butter spread on their bread and so forth. And it did show decreased numbers of heart attacks and strokes in the people who followed the Mediterranean diet. So what's the Mediterranean diet? It's the Israeli. Well, you're here on the Mediterranean. It's what you're eating in Israel. It's lots of salads, lots of fruits, nuts, some seafood, not big portions of red meat, and not a lot of what my wife likes to call sugar-rated. In other words, crawling, way too sweet sugars. My wife is Chinese, and the Chinese tend to overdo it with salt, but they way underdo it with sugar. So she'll taste something, she'll say, this is way too sugar-rated. It means she's right, it's way too much sugar in there. And that's sugar and simple carbohydrates like white flour actually very rapidly push people in the direction of obesity, of getting fat, and also the direction of diabetes. So that's why we like whole grain things like pumpernickel bread and whole grain breads, and cereals that have lots of fiber in them. But also what's been discovered in the last 15 to 20 years is less carbohydrates. And the carbohydrates, those are the simple, that's sugars, or simple carbohydrates, sugars and white flour, things like that, as opposed to the complex carbohydrates, which are the ones found in vegetables. Those tend much less to push people in the direction of diabetes and obesity.